Hello,
Hi.
my name is Daniel. I'm going to be your nurse today. I'm here to do a head-to-toe assessment on you. It's only going to take about 10 to 15 minutes. I've already closed the door for your privacy. Before we get started, do you have any questions? Okay, can you tell me your full name and date of birth?
Grant Gerteaser, date of birth is December 10th, 1997.
Okay, and do you know where we're at today?
We're at Cox North.
Okay, and what is the date?
It is November 22nd.
Okay, and can you tell me about your personal hygiene?
Yeah, I brush my teeth twice a day and I shower once a day.
Okay, and are you in any pain today?
No.
And do you have any allergies?
Nope.
Okay, so the patient is alert and oriented to time, place, and person. The posture is sitting and relaxed. Their behavior and mood is appropriate for the situation. Their hygiene is appropriate, and there are no lines, tubes, or drains. Okay, I'm going to take a look at your scalp first thing. You have any pain or tenderness? Okay. So the scalp is clear, there are no lesions, the hair is evenly distributed, the face is pink, it is dry and warm, there are no lesions, edema, pitting, swelling. I'm going to take a look at your eyes. Just look forward for me. Now look at the pen and look at me. Now look at the pen and look at me. And so pupils are equally round and reactive to light and accommodation. They're about 6 millimeters in diameter. Can you pull down your eyelids for me? Okay, the eyes are not bloodshot, the sclera is white, the conjunctiva and the cornea are clear, the irises are brown. There we go. Okay, and can you read the top sentence on here for me?
Card is held in good light 14 inches from eye.
Okay, vision is intact. Okay, now I'm going to take a look at your ears. The ear canals are clear, there's no drainage, the ears are symmetrical and vertically shaped. Can you plug one ear and wiggle your finger, and I'm going to whisper in the other and have you repeat back what I say.
Okay. Blue moon. Light tight.
Okay, hearing is intact. I'm going to look at your nose. The nares are patent, the nose is straight, and there's no drainage. Okay, get a tongue depressor. Okay, can you open your mouth for me? Say ah.
Ah.
Okay. The tongue and uvula is midline. The uvula rises with speech. The oral mucosa is pink and moist. There are no lesions and all teeth are intact. Okay, now can I have you look up for me? The trachea is midline. Now look down. Now can you look to your left? Now look to your right. Now place your right ear on your right shoulder. Now left ear on your left shoulder. Okay. The patient has full range of motion in the neck and there's no JVD. I'm going to check your carotid pulses. Carotid pulses are equal and regular bilaterally 2+. I'm going to listen for bruits. Just breathe normally for me. There are no bruits. Okay. I'm going to assess your upper extremities. Can you lift your arms above your head? Now out to the sides. Up like this. Up behind you. Okay. Now, can you put your arms up like this? Now pull. Now push. Okay. Patient has full range of motion in the upper extremities and strength is 5+. The skin is warm and pink. There are no lesions, no swelling, no tinting or edema. Okay, now I'm going to check your capillary refill. capillary refill is less than 2 seconds. I'm going to check your radial and brachial pulses. Radial and brachial pulses are equal, regular, and 2+ bilaterally. Okay, I'm going to check the sensation in your arms. So what I'm going to do is I'm going to touch you with this side, and that'll be the sharp side, and then this will be the dull side. So I'll have you close your eyes and tell me which one is which.
Okay.
Okay?
Sharp. Dull. Sharp. 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 Dull.
Good. Senses are intact. Okay. Now I'm going to examine your chest. If you don't mind just pulling your... Okay. The chest is pink. The thorax is symmetrical. I'm going to listen to your heart sounds first. Okay, there are regular S1 and S2 sounds at the aortic, pulmonic, herbs, mitral, and tricuspid areas. The point of maximum impulse is located at the 5th intercostal space in the midclavicular line, and there were no rubs or gallops or other sounds heard. Okay, now I'm going to listen to your lung sounds.
Okay.
So I'm going to place the diaphragm, and each time I place it, I want you to take a deep breath for me.
Okay.
I'm going to do the same thing on your back. Okay, breath sounds are clear. There are no adventitious sounds. I'm going to have you cross your arms in front of you. Now take one more deep breath for me. Okay, and lungs are symmetric with expansion. Okay, now I'm going to have you lie down for me, and I'm going to assess your abdomen. Okay, the abdomen is pink. It is warm. There are no lesions, no masses, no visible pulsations. Can you tell me when your last bowel movement was?
Yesterday.
Okay. And when was your last void?
About an hour ago.
Okay. And have you experienced any urinary incontinence, any frequency, urgency?
No.
Okay, great. So I'm going to listen to your bowel sounds now. There are active bowel sounds in all 4 quadrants. Okay, now I'm going to palpate a little bit. Let me know if you feel any tenderness or pain.
Okay.
Okay, the abdomen is soft. There are no masses, and the spleen and liver are not palpable. Okay, you can lower this, and I'm going to look at your lower extremities. The skin is pink. It is warm to the touch. There's no excessive dryness, no edema, no tinting. I'm going to check your capillary refill real quick. It's less than 2 seconds. And I'll check your pedal pulses. Pedal pulses are regular and equal. They are 2+ bilaterally. Okay, now I'm going to check your range of motion. Let me know if you have any pain.
Okay.
Now, can you roll your ankle? Okay, I'm going to do the same thing on the other side. Roll your ankle. Okay. Now, can you push and pull? Okay, now push up, push down. Good. Patient has full range of motion in the lower extremities, no crepitus or pain, and strength is 5+. Okay. Now I'm going to check the sensation in your lower extremities. So we're going to do the same thing as we did earlier. This will be sharp and this will be dull.
Okay.
Close your eyes.
Sharp. Dull. Sharp. Dull. Dull. Sharp.
Okay. Sensation in lower extremities is intact. Alrighty, so I'm going to have you stand up for me. Can you bend over and touch your toes? Okay, now lean backwards. Now lean to the left and lean to the right. Patient has full range of motion in the spine, no crepitus. Okay, now I'm going to have you walk to this wall just like you normally would walk. The gait is regular and relaxed and smooth. Now I'm going to have you walk back on your toes. Now back on your heels. Now heel to toe. The cerebellum is intact. So that is the end of our assessment today. Do you have any questions?
No.
Okay, well thank you for your patience and thanks for choosing Cox.
Thank
Have
you.
a good day.